friends all around. In community gardens where joy can be found. We're sharing our stories.
This is Mike Roth on episode number 3 of Creating a Better Life for Seniors. And today's episode is all about the 2026 Medicare Enrollment Period for plans beginning January 1st, 2027. 11,000 Americans are turning 65 each day, which makes them eligible for Medicare. What should they be doing in the months ahead of time to prepare for signing up for Medicare just before their 65th birthday?
The Medicare Initial Enrollment Period runs for a total of actually 7 months. At 3 months before your birthday, if you're turning age 65, your birthday itself, and the 3 months after your birthday. Now, that's if you're turning age 65 for the first time. So the example would be if your birthday is in August, if you enroll in May, your coverage can begin August the 1st. So preparation is going to give you time to make the right decisions, and you won't have to panic or worry about whether you're making the right decisions for yourself if you prepare. So the bottom line is every month you wait to push out your coverage.
Most people ask about Medicare Part B first because it covers doctor's visits.
But it covers doctor's visits, which include appointments, routine checkups, and surgeries in-house, outpatient care, clinics, ERs, and same-day surgery. Now, people get confused by that because if you have cancer, for example, a cancer clinic is really in Medicare B. Most people think it's at a hospital, and it's not. And your drugs in these clinics are not included in Medicare D either. The drugs in these clinics are considered Medicare B expenses and are billed that way. And so same-day surgery is another example. Preventative screenings are another Medicare B feature, and that's for your flu shots, for your annual wellness visits, and then there are tests and diagnostics, lab tests, x-rays, MRIs. So that covers all of the Medicare B services. Basically, if you're going to see a physician, whether it's in his office or in a clinic of some kind, that's Medicare B. If you go to a hospital or a nursing home, that's not B.
Okay. Is there a cost for participants who want to buy Medicare Part B?
Yeah, typically the annual premium for most people is $202.90 per month. High earners, people who earn above $109,000, if you're single, or $218,000 in a joint return, they pay additional, and that can be up to $689 a year, depending upon how high your income is. The annual deductible is $283, is also a factor, and you have to pay that. Co-insurance after deductible, you typically pay a 20% co-insurance for approved services. As far as Part A is concerned, that's inpatient hospital care, room, meals, nursing, medication, and so forth. Home health care, part-time skilled nursing, and therapy is also included. Skilled nursing facilities, they're between home care and the hospital. Most people go there for rehab. It's a short-term, after a qualifying 3-day minimum inpatient stay. Be careful of that, because if you are in the hospital and they don't classify you as having been there 3 minimum inpatient days, if they say you're just under observation for 2 days and an inpatient 1, then you would not qualify for a nursing facility. So that's an important issue. Hospice care, support and pain relief for terminally ill patients is also included in Part A.
All that is in Part A.
There's no monthly premium, I should say. If you've paid your Medicare taxes for at least 10 years, there's no premium for Part A. However, if you should be hospitalized, it'll pay $1,736 per benefit period. A benefit period is 1 to 60 days, but when you exceed those limits, you're going to pay $434 a day if you have 61 to 90 days cost. You do have to remember that the hospitalization can be expensive, unless, of course, your Medicare Advantage or your Medigap coverage is taking care of those, but those are out-of-pocket numbers.
So you mean supplemental care policies?
Yes, Medigap is synonymous with supplemental care policies, and that's your coverage beyond Medicare A and B standard.
And the coverage per day is really the important number, isn't it, Bill?
Yeah, if you exhaust the number of days allowed up front, 1 to 60 days, the 61 to 90-day cost for that period of 29 days is $434 a day.
Let's talk about Medicare Part D, although most people call it a drug plan. Tell us about how that works.
Medicare Part D is a plan that was instituted in 2003, prescription drug plans. Now, you can be in Medicare Part D as an individual, or in the case of Medicare Advantage plans, a Medicare Part D plan can be included in your Medicare A and B services they provide, normally at a lower premium rate as a result of government funding for that. And then if you want to, you can change your mind after enrolling. You have exactly 30 days to do that. The Medicare Part D is an optional private program for prescription drugs.
Bill, why don't you tell us about the different Medicare Advantage benefits and costs and how they differ from traditional Medicare? What about deductibles and other things?
To start with, everyone in Medicare has Medicare A and B. The original Medicare requires that you would also carry some other supplemental coverage to cover the 20% that Medicare does not cover against. In Medicare Advantage plans, they are actually called Medicare C because it's the combination of A and B. And most times they don't pay a premium because there's a subsidy that covers that. And also, they have prescription drug plans that are included in them as opposed to original Medicare A and B, where you have to buy it independently.
Okay. I guess that's one of the reasons people think the Advantage plan is an advantage.
Well, that's true. As a matter of fact, it's a major reason why people look at them, because they know they're getting basically a free prescription drug plan, whereas everyone else has to pay maybe $30 a month.
So the drug plans and the Advantage plans are free. The drugs are per.
They're not free to the taxpayer because the government has arranged to subsidize private insurance plans, pay them enough money in rebates so that they can use those rebate dollars that are taxpayer funded to purchase the premium for anyone in a Medicare Advantage plan who has a prescription drug plan that included in it. And so therefore, instead of having to pay that premium, they don't have to pay it. They save $20, $30 a month. But in effect, it's not the insurance company that does it. It's the government underwriting the premium. And yes, so that's an advantage to people in a Medicare Advantage plan.
In 2026, tell us about the out-of-pocket costs that are capped.
The capping that program was implemented in 2025, and now this year at $2,000 a year, and this year it's $2,100 a year. Basically, the bottom line on that is you can't pay more than that much money in any given year.
Anyone buying prescription drugs that are advertised on television.
That's true.
They find that out real fast.
Especially if the label is about 2 pages long. After Medicare covers your drugs, you have to enroll in a Part D plan, even if you take 0 medications. Right now, you have to go through 63 days or more without drug coverage. You face a permanent late penalty of 1% for every month you wait. And the message here is that during this enrollment period, you have to be prepared to make a decision. The earlier you start, the less confusion there will be when it's time to evaluate and make decisions.
Bill, let's try to delineate the differences between traditional Medicare.
The major differences are that a Medicare Advantage plan has an out-of-pocket maximum. Typically, both of these plans are the same in that there's a Plan A and Plan B. Usually a premium deductible and all that is about the same for everyone. But when you get to a Medicare C plan, which includes prescription drugs and other benefits, you actually benefit to the extent that you have to pay only up to a maximum. This year, it's around $5,000 minimum, but up to $9,900 in some places in the country that you have to come out of pocket before you actually get the insurance company to pay anything. But what happens is that in many cases, people basically say, well, I'm not going to be sick. I'm only going to pay $150 a year. Even if it's $2,100 under Medicare plan, I'm healthy. What they don't count on is when they really get sick, there's a saying that's going around that Medicare Advantage plans are just fine as long as you don't get sick. Because if you get sick, you're paying up to that maximum every year. So divide your total out-of-pocket of $5,000 by 12 months. That's your monthly premium equivalent if you were buying a Medigap plan that would cover you. And the Medigap plan has to be purchased by people who are in original Medicare, not Medicare A and B. I think that's the biggest difference. The other significant difference to me is that Medicare Advantage plans have an average of $2,500 a year the insurance companies get to spend on these free benefits for Medicare Advantage plans, like prescription drugs, eyeglasses, dental, gym memberships, and so forth, that others in Medicare A and B do not get.
Well, to me, the big difference between traditional Medicare and the Advantage plans is that if you travel outside of your own county, sometimes you'll be stuck with big medical bills because the doctors in this new location inside the United States will not be part of the group, and you'll be treated as an out-of-group patient, and there'll be much higher deductibles and fees that you have to pay, whereas traditional Medicare, almost any place you go in the States, is covered.
Yeah.
And you have a freedom of choice. You don't need referral.
That's right. In many hospitals like Shands in Florida, cancer centers and around the country, they will not even accept Medicare plans. They just won't contract with them because of that lack of coverage. They will not pay up to what Medicare pays. So that is a significant problem. These are called selection problems, basically a networking problem. In preferred provider organization, PPO private plans, you can go out of network, but you can only go out of network to the extent that you meet certain limits. So they usually rate it. You can be out in network and out of network combined up to a certain maximum. But there are still limitations even in the preferred provider plans. This is a big issue for a lot of people, and for some it's not an issue. So yes, that's a deterrent from keeping people to sign up for those plans.
I heard a story of a lady who needed to have her kidney removed with cancer, and she had a surgeon, and she was going to be having it done down at Moffitt in Tampa, and her Advantage plan said that's out of network and you can't do it. You have to get a different doctor. We're not going to pay anything.
And we have another thing going around now, of course, with all this upcoding, but denial of coverage. A lot of this denial of coverage of doctors who say, you need a CRT scan, you need a CRT. And because I can't see how big that tumor is, or I can't tell whether it's malignant or not in your brain. And Medicare says, no, Medicare Advantage providers, HMO plans in particular, are going to, at a minimum, delay it and to try to get to see if it's justified. When they won't take the doctor's opinion, I think it's a terrible thing, especially when it's a life-threatening potential.
On the other side, as a traditional Medicare subscriber, if I need a MRI or a CAT scan, the doctor wires that over, and virtually the next day, it's convenient for me. It seems like a world of difference that people are being denied care by the carriers, that the carrier is being paid, but the carrier doesn't want to pay out the money, so they try to delay it.
That's very true, and I will mention now, though, the scary thing is that the CMS has trials going under what's called a Wiser,
CMS.
Center for Medicare and Medicaid Services, Washington, D.C. That's the organization that runs Medicare, CMS. They are now in the process of making a study in original Medicare of whether or not they should implement the same logic that Medicare Advantage plans implement. Have someone at a desk somewhere in Chicago decide whether or not a doctor in Texas should authorize an MRI.
That's crazy.
It is crazy. And the NRLN we wrote letters and lobbied and action alerts to everyone in Washington. Despite that, they would not pass a bill that would stop the Wiser program. So it's continuing right now. There's a risk that could happen also to original Medicare.
Yeah, that seems to me to be unreasonable rationing of medical care. Yeah. Terrible idea.
And they're using AI technology to determine when you should accept or deny. And the AI machines don't have all the experience. They don't have all the data in there yet. And how can they get in the doctor's head to know it's necessary or not. So,
Now,
okay.
now what about these extra perks that some of these plans are, the Advantage plans are giving, like vision or
authorized in Chronics Act of 2017 was legalized in the 2018 Bipartisan Budget Act. In there, they authorized 18 additional benefits that the government would fund, or that the government authorized private plans to use rebate money to pay for only people in Medicare Advantage plans, which gives them a marketing advantage.
Well, some of the things make sense.
Yeah.
Dental makes sense.
But now they're admitting that all those benefits they approved are not really attack chronic disease, just some of them. As I mentioned in an earlier podcast, 80% of all that Medicare pays out to all providers on behalf of all claims in Medicare, 80% of the money paid out is only paid on behalf of claims for people that are only 25% of the people. So 25% of the people consume 80% of all the billings Medicare pays. And those are the older chronically ill people. You don't have a heart problem or a pacemaker like I have. You don't have had a brain bleed. You don't have those kind of problems when you're 65 years old. And that's where most of the people have been when they signed up for Medicare. Now they're getting older and the costs are going up and they're really in a squeeze.
So the Medicare Advantage plan participants get hurt more as they get older.
As we age, we incur illnesses of all kinds.
Yes,
and injuries as well.
But their out-of-pocket is higher.
The premiums get higher. Now, I just as an example, one of these irrelevant benefits they pay for is that I have a friend that I know in Chicago. They pay his green fees.
Sure.
Part of the exercise program. Be healthy. So it's basically
I know some of the programs pay for groceries. Okay. And
over the counter
at the pharmacy. Now, the back end of that is it leads to medical rationing. So you have to recognize what you're getting into. Okay. Recommendation to people is always go traditional Medicare and then buy the best supplement plan you can have. So maybe we should tell people how they can get some help in choosing a plan to enroll in.
If you've never been in Medicare before, you're not 65, get a neighbor who is over 65 or a friend, someone, and get a copy of Medicare and You. Because if you're in Medicare, every year, Medicare updates and sends to everybody that is in Medicare a copy of the Medicare and You handbook.
Okay, so they get the Medicare enrollment book.
Right.
Now, they need to get help officially from the Social Security Administration. How do they do that?
The best way to enter the process at age 65 is to call 800-877-2123. We will present all this on our website for you so you can get these numbers. But you call the Social Security Administration, and they will give you the references to Medicare.gov to go through the sign-up procedures.
For Medicare.gov, that's the central hub for all information. The telephone number, again, is 800-633-4227.
And the third source is your state health insurance agency called the SHIP coordinators. If you look in the back of the Medicare and You book, you can get the phone number for your SHIP coordinators in every state. They also work one-on-one with enrollees to help you. Yeah, and I would say further, when this podcast is posted, everything that is in our presentation today will be posted on you'll have access to it.
Now, Bill, what kind of information should people have about buying Medicare or Medigap plans from independent insurance agents? What's your advice?
The question is, how do you get the best information? Because you don't have the advantage of being able to call Medicare or get a Medicare and You handbook or listen to this broadcaster. We don't have access to manage everybody in the country. So primarily what's happening is plans are being terminated across the country because the cost of Medicare Advantage plans is catching up with them. As people get older, they get sicker, and they use more benefits. Now, people are sicker, they're incurring illnesses, more billings, and so plans are becoming unaffordable. We're going to see premiums go through the roof. So the best thing you can do is go to Medicare.gov, go to Plan Finder, knowing all you know about your own plan, Know about your own health condition. Know about how you feel, what is your family history, and so forth. And gauge for yourself what plan type you want. If you want a Medicare Advantage plan, or if you want a drug plan, or if you want a Medigap, a supplemental plan, which was the original question here, you go to this plan finder and you put in your age, your sex, your zip code, and whether you smoke or not. You don't have to put your phone number or anything in there. You say, I want this kind of plan, and CMS provides a list of that plan type for your county that's available, and they list it in order of lowest price to highest price.
That's Medicare.gov. Second, okay, some of these, when you're looking at the Medicare site directly, you get to choose which plan that you want to use that covers what you want covered at the price that's reasonable for you. I think that's really the
important element there is that you buy direct from the insurance company. You don't buy through your agent.
Okay.
Basically, you cut out the commission.
Now,
It's a big deal.
let's talk about this year's, because it's coming right up.
Well, this is what we're getting prepared for, as you can see, October 15th through December 7th. So between now and October the 15th, this is the kickoff. This is our first attempt to try to give people some advantages to get started early.
Okay.
So then there's also an enrollment period, January 1 through December through March 31 for Advantage Plan open enrollment.
Okay. So people can change if they want from a traditional Medicare plan to an Advantage plan between January 1st and
Yes.
March 1st.
And the most important caveat there is if you switch to a Medicare Advantage plan and you're in one for more than a year, you can't switch them. If you pay, you're going to pay through the nose.
The only way that you're going to be able to get back for most people who don't move is if you're canceled by your original insurer and you get what kind of a letter is it? With a guaranteed issue to go back over to Medicare. So sometimes, and we mentioned this earlier, if you get canceled by your plan carrier because the plan is terminated in your particular zip code, you actually are lucky because you can then turn around and go from Advantage back to traditional Medicare.
And you can do it with knowing you cannot be refused. They cannot deny you coverage, no matter whether you're on your deathbed. They cannot deny you coverage no higher than anybody else in the marketplace. If you don't get that guarantee issue, you can be in real trouble. And many times your agent doesn't steer you in the right direction. But we're going to talk about this subject. This is our last subject of the series here, probably in about 3 or 4 weeks. And we're going to talk in depth about guarantee issue rights, what you should do when you're notified, what's supposed to be in these letters. And we want you to notify us at our contact point, which we'll tell you later when we get into that issue. So this time we're going to the Attorney General's office and say, why aren't you suing the insurance companies? Because the CMS has the authority to assess $5,000 fines per person to anyone who manipulates these minimum legal standards, and they can then imprison them for up to 5 years in jail. And we're going to say, why isn't that being done?
Okay, but I think we have one more thing to talk about for enrollment in the drug plans today. Drug plans open to enrollment when?
Oh, it's part of the Medicare enrollment process.
So it's
October 15th.
October 15th.
Yeah. But you can buy a drug plan at any time because all these plans you can buy at any time because they're private plans. Okay. But it's Medicare that have Medicare plans under the guise of Medicare payments and so forth that you have to enroll. Because you have A and B coverage in Medicare, you're getting paid by Medicare, then you have to go through the enrollment during the enrollment period.
Okay. So I guess the important thing is don't miss the open enrollment period if you think you might want to change plans. And I think you need to watch our next video coming up in about 2 weeks on guaranteed issue rights denied. Okay. Bill, anything else we need to add to that?
No, I think we've covered quite a bit. If you have any questions, please go to our email message, nrlmessage@msn.com, or call 1-866-360-7197. Creating a better life for seniors. Welcome. Good night.
And let them take a look at the page and go to the website and decide whether or not they want to join, become part
Absolutely.
of the independent advocacy movement for seniors.
Absolutely.
Good.
Stepping out the door with a dream in our hearts. Golden years are here, but this is just the start. We've worked hard, now it's time to play. Building up our future in a brighter way. Warmth of the sun as we stroll down the lane. Planning for the things that we can attain. With smiles on our faces, we embrace the day. Life's a canvas now, we're painting it our way. Better days ahead, we're creating the dream. With protection and care, we're a mighty team. Income flowing strong, health on our side. Living healthy lifestyles with love as our guide. Hear the laughter ringing from friends all around. In community gardens where joy can be found. We're sharing our stories filled with past hopes. In this vibrant life, we manage our scopes. From yoga in the park to cooking classes too. Every new adventure brings a bright view. Holistic health matters, we're learning each day. Making choices that matter in every way. Better days ahead, we're creating the dream. Oh, with protection and care, we're a mighty team. Oh, income flowing strong, health on our side. Living healthy lifestyles with love as our guide. Oh, oh, hey, hey. We invest in our future with minds that are clear. Planning for tomorrow with hope, not fear. Through laughter and kindness, we find our way. Building a life where we're free to sway. So let's lift our voices, let's dance in the sun. Celebrating life and all we've done. With every heartbeat, we cherish this ride. Creating better paths with passion inside. Better days ahead, we're creating the dream. Oh, with protection and care, we're a mighty team. Oh, income flowing strong, health on our side. Living healthy lifestyles with love as our guide. So here's to the future where dreams come alive. Together we can thrive and effortlessly strive. In harmony we flourish with hope in our hands. Better days ahead. We're taking